Okay, hello. I'll be doing administrating medication into a peg tube. And first, I'll go ahead and just check my documentation, make sure that I have an order to put in for the member, for the patient. I'll make sure that this is the right patient that's supposed to be getting this medication. I also make sure I check the route. Patients have right to say no, and they have their own rights. So I'll make sure that I check the rights of seven. I'll make sure I check the route of the medication, the dose, the timing, if I have the right um, patient, the right route, the right medication, and also just the right date. And before I go ahead and begin to enter into the patient's room, and then I'll also make sure I got everything that I need before I enter the patient room. So I'll come into the patient room now, do hand hygiene. I'll make sure I let them know what I'll be doing, that I'll be giving them medication today. And I will also, before I begin to administer any medication, I'll check the vital signs, check the vital signs, just to make sure that everything is normal, nothing is out of the ordinary, nothing, the blood pressure is not up from anything that happened in the past. I will also make sure that I ensure that I don't have any PRN medications that's supposed to be given to the patient. After certain bowel sounds, I go ahead and pretty much auscultate um, the peg to just make sure I don't see edema, any redness, any odor coming from it. What could be like signs from infection. I'll check the drainage also. Then I also make sure I check the placement, because before I insert anything, before anything goes in this tube, I need to make sure that it is in the correct spot, because I don't want it to end up in the lungs. I can check that by the pH, make sure that it's less than 5.5. I can check that by the x-ray that was supposed to be sent off after inserting of the peg tube, and I can also check it from the bowel sounds. Um, then I will also just make sure that I check the medication administration record, that this is medication that's properly for this patient. I will also make sure that this medication can be crushed, because we cannot crush anything that's substance released, any enteric-coated medications, because those medications could go down and erupt the stomach, upset the stomach. And I have to also make sure that we do not mix any medications, because we don't want any medication to pretty much get involved with the other one, and it could do some damages um, to the patient in their stomach and erupt them. So today we're going to be giving two medications. It's going to be baby aspirin. So I'm going to do those together. They will be crushed. Um, and I will go ahead and wash my hands, do standard precautions, and go ahead and put on my gloves, and then we'll go ahead and get it started. We already verified. I'll make sure that I do 3 verifications. One before I enter into the patient room. One once I actually get into the patient room and verify and go over the instructions on what I'm doing here and what I'm doing for the patient today. And then before I give that patient that medication, once I get my water and everything set up, I will verify one last time just to make sure. So I will do 3 checks before I give that patient any medications. And then I will go ahead and just do the central before I begin giving this patient any medication. I'm going to clamp, kind of do a little clamping on my tube, and I'm going to go ahead and unattach it. I would like to flush it. So I said I'm going to flush it with 50 mils. Flushing, I just want to make sure I get out of excess anything that could have been given to the patient but prior to me coming into the room. It could be medication. Once I actually attach this, I'm going to let this go. It could be medication. It could be food. So I just want to make sure that I flush all that out. And this is my shuck suction. And this is my tube. I'm going to go ahead and begin flushing it. slowly. Alright, once I do that, alright, so that is secure. So I'm going to take this off so I can go ahead and put this clamp back on. I'm going to go ahead and take this completely off because I don't need that. So I'm going to clamp it and take this off, and I'm going to stick this down there without that and let it stay here. Okay, so with my crush medications, I'll add a little water in it just to make a slurpee. And then I will go ahead and proceed with my medication. I already verified 3 times. I checked to make sure that it's the right patient, and it's the right dose and it's the right time. So I will go ahead, pour this down into there, and then I will add my water. I'm going to do 20 mLs, and I'm going to raise it up so my water can go down into my tube. The higher you go up, the faster it can go into the patient's stomach. When I get down to about 10, I'm going to clamp it. And then if I had some more medication, I would go ahead and do it, but I do not. So I'm going to clamp this because I don't want any air to get in my patient's stomach. And then I'm going to add 30 more just to make sure that I flush everything all the way down. Okay. Alright. I have flushed it. I'll put it there. I will go ahead and clamp this back. And if I have to do any continuation, I will come back within 1 or 2 hours for the patient. Also, before I actually begin that, I'll make sure that I put the patient up in a semi-fetal position before I actually begin the feeding, just so I won't have to have, for the patient won't have any aspirations while getting fed and getting their medications. Then I will also leave them sitting up for about 30 minutes so the stomach could settle and we won't have to worry about an eruption or aspiration in the stomach. Then I will gather all my stuff. I will let my bed down low level, get them the call light, make sure their bed is locked. If they're still sitting up in the bed or sitting up in their chair, see if they need anything before I leave. And then I will document how much I gave to the patient, the time, with my initials, and then documenting the findings that I had dealing with the peg, if there was any redness or if the patient felt nausea or just how they felt. And then I will go ahead and perform hand hygiene and then leave. Then I will come back and check on my patient between 30 to 45 minutes just to make sure how they're feeling after getting their medications.